Hello everyone, my name is Jacob Robertson, and today I will be speaking about ADHD within the adolescent and young adult population. The purpose of this presentation is not only to understand what ADHD is, but look at ADHD's effect on healthcare, the stakeholders, culture, politics, and nursing role as it relates to the disorder. ADHD was chosen to discuss because of the general population it is presented in. While it will be covered in the presentation, ADHD is the most widespread mental health condition among youth in America and often requires pharmacological and therapeutic intervention. This puts a large strain on the individuals, their families, and healthcare system to meet the demands of these patients. ADHD is one of the most common neurodevelopmental disorders in childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, control impulsive behaviors, may act without thinking about the result will be, or be overly active. It is normal for children to have trouble focusing and behaving at one time or another. However, children with ADHD do not just grow out of these behaviors. These symptoms continue, can be severe, and can cause difficulty at school, at home, or with friends. A child with ADHD might daydream a lot, forget to or lose things, squirm or fidget, talk too much, make careless mistakes, or take unnecessary risks, have a hard time resisting temptation, having trouble taking turns, having difficulty getting along with others. There are 3 different ways ADHD presents itself, depending on which type of symptoms are strongest in the individual. Predominantly inattentive presentation is where it is hard for the individual to organize or finish a task, to pay attention to details, or to follow instructions or conversations. The person is easily distracted or forgets details of daily routines. Predominantly hyperactive, impulsive presentation, the person fidgets and talks a lot. It is hard to sit still for long periods of times for a meal or while doing homework. Smaller children may run, jump, or climb constantly. The individual feels restless and has trouble with impulsivity. Someone who is impulsive may interrupt others a lot, grab things, people, or speak at inappropriate times. A person who is impulsive may have accidents and injuries, and it may cause them to others. Combined presentations are usually symptoms of the above 2, or which are equally present, or have rule-out symptoms. The 2016 National Survey of Children's Health interviewed parents and reports the following ADHD prevalence data among children ages 2 to 17. 6.1 million children have ever been diagnosed with ADHD. This includes about 388,000 young children ages 2 to 5, 2.4 million school-aged children 6 to 11, and 3.3 million adolescents ages 12 to 17. That's 13.6% of this age group, and that continues on into adulthood. As we see, 6.1% of American children are being treated with ADHD medication directly. Boys are more likely to be diagnosed with ADHD than girls, and as we see, there's disproportionate populations where Black populations are higher affected by ADHD at 10.7% of children in the African American population. This is a 42% increase in ADHD diagnosis over the last 8 years. This factor is something that raises the chances of getting a health problem. A person can get ADHD with or without the ones listed below. The chances of getting attention deficit disorder are greater in people who have many compounding risk factors. Genetics: people who have parents or siblings with ADHD are more likely to get it themselves. This includes twins who will both have ADHD. ADHD occurs more in boys. Birth factors such as low weight, such as being born very early or early pregnancy. Factors that affect the mother during pregnancy, which are smoking, using drugs, or drinking alcohol, using certain medicines such as corticosteroids and antidepressants, mental health problems, high blood pressure, hyperthyroidism, exposure to certain environmental toxins as well, like lead, can affect ADHD, studies have shown. A misconception is that parenting causes ADHD, which there is no evidence to support that parenting causes ADHD. Children with ADHD often benefit from behavior therapy, social skills training, parent skill training, and counseling, which may be provided by psychiatrists, a psychologist, social workers, or other mental health professionals. Some children with ADHD may also have other conditions such as anxiety disorders or depression. In these cases, counseling may help both ADHD and a coexisting problem. Examples in therapy can include behavior therapy. Teachers and parents can learn behavior-changing strategies such as token rewarding systems, timeouts for dealing with difficult situations, or parenting techniques. Social skills training. This can help children learn appropriate social behaviors. Parenting skills training. This can help parents develop ways to understand and guide their child's behavior. This can also be in reverse effect for ADHD parents who receive parenting training or just basically instructional training. Guided behavioral therapy. Psychotherapy, where older adults or children with ADHD talk about their issues that bother them, explore negative behavior patterns, and learn ways to deal with these symptoms. Family therapy can help parents and siblings deal with stress of living with someone who has ADHD, and it can help that person feel more accepted in the group. Currently, stimulant drugs like psychostimulants are the most commonly prescribed medication for ADHD. Stimulants appear to boost and balance levels of brain chemicals called neurotransmitters. These medications help improve the signs and symptoms of inattention and hyperactivity, sometimes effectively in a short period of time. This includes amphetamines and methylphenidates. Stimulant drugs are available in short-acting. The right dose varies from child to child, so it may take some time to find the correct dose. And the dose may need to be adjusted because significant side effects can occur. This is hard on children, adults, where sleep problems, decreased appetite, mood disorders, and tics can occur. Other ADHD medicine side effects include jitteriness, irritability, moodiness, headaches, stomach upset, heart rate, high blood pressure going up, all which are difficult for a young child, their family, the adult with ADHD, so the pharmacological intervention is considered a second-line treatment for this reason. So now that it's been gone over why ADHD was chosen, why ADHD is important, and really what ADHD is, it's important to talk about the impact of healthcare quality on these patient outcomes. We see a lot of the desired outcomes as ability to cope, remaining attentive, increase awareness, but in certain cases, especially where there's a lack of treatment, we see observed outcomes like addictive behavior, education needs, antisocial behavior, and a lack of health literacy and educational literacy. So what we see, healthcare quality is the leading determinant in patient outcomes as it relates to mental health for ADHD patients. Desired outcomes are those abilities to remain attentive, ability to cope, and increase awareness. Patients report poor satisfaction based on education. So this has been in multiple studies among a study of 171 included patients, only 61 reported being satisfied to a large or very large extent that they received quality health care. The strongest predictor for overall satisfaction, independent of duration, medication, or reported outcome of treatment, was whether they were satisfied with the information that they received from clinicians regarding ADHD and treatment options. This will be gone on further in the presentation about how nurses can bridge this gap. It is oftentimes that patients don't feel that they are offered treatments in addition to pharmacological therapies, and these are the same patients that are not generally satisfied. So without treatment and guidance, they may have trouble making or keeping friends. This can be hard for them dealing with, especially for children who are untreated with ADHD, also have low self-esteem and depression because of this. Individuals with untreated ADHD have higher rates of unemployment and frequent job changes in adults, and often are overlooked for high-paying positions. Many adjunct therapies require patient participation and learning. When this is not available for children, they are unable to receive care and rely on medications. In many cases, medications may not be available either. In 2020, nearly 19% of children living in families below the federal poverty level had a diagnosis of ADHD or a learning disability, compared to about 13% of families at or above poverty level, which draws some conclusions about continuity of care and maternity care, especially when ADHD is often affected by the mother and their habits. So when that poverty level is not getting good quality of health care at the maternity level, then that may be continuing to the child in the form of ADHD. In a study conducted by the School of Mental Health in a sample of about 222 adolescents with ADHD randomly assigned to receive two different interventions, the present study evaluated that impacts of income, maternal education, single parent status, and race on affected intervention efficacy, which means that thus it was seen that population healthcare quality and ability to address the social determinants of health had an impact of the efficacy of treatment. Patients who do receive medications have seen that medications do improve ADHD symptoms. So on the brighter side, we see that about 70% of adults and 70% to 80% of children shortly after starting treatment have seen improvements. Improvements include reducing interrupting, fidgeting, and other hyperactive symptoms, and more improved task completion and home relationships. And behavioral therapy can help people with ADHD develop new, more positive behaviors and help them manage these symptoms more effectively. Behavioral therapy may work alongside medication and is often a part of an ADHD treatment plan. So healthcare quality can be clearly seen that it sustains occurrences of ADHD in population with impacted healthcare. Not only is there satisfaction reduced when patients do not receive quality options for treatment of ADHD, but in many cases based upon healthcare accessibility, children and adults can go without treatment. This can lead to job loss, depression, social isolation, and much more. It has been evidenced that children in poverty have much higher chances of ADHD. This is possibly related to maternity care options, environmental toxin exposure, and smoking statistics. Without healthcare opportunities and high-quality healthcare at every level, patients can go untreated and ADHD occurrence can pick up. I'd like to take the time to shift the discussion to patients, family, healthcare workers, the measurement of their safety and how their safety is affected by ADHD. Patients who have ADHD may display impulsive or defiant and aggressive behaviors. This is especially true in children. Children with ADHD are at increased risk of mental health and emotional concerns and disorders such as behavioral health disorders, mood disorders, being victim of bullying, using tobacco or other high-risk substances, sexual risky behavior, and children with ADHD are at increased risk of gaining weight, obesity, healthy habits that can combat this are healthy eating habits, participating in daily physical activity. It seemed that drug abuse is common and driving is also an issue because when patients are not keeping up with that attention deficit disorder medications, they can be easily distracted when driving. And this also, as mentioned before, comes to a possible increased risk of injury among patient populations with ADHD. There's also family safety concerns, especially those who are parents of ADHD patients. Symptoms of ADHD have profound effects not only on the child, but also the child's parents. For example, children's ADHD is frequently linked with strain in the parent-child relationship, disturbances in parent marital functioning. This is an example of this would be less marital satisfaction, more conflict with parents and children without ADHD, and extremely high parental stress. Researchers found that high school graduates with ADHD earn about 17% less than their peers. They are more likely to become unemployed and receive disability benefits related to their inability to work, meaning parents may need to be financially supporting their children with ADHD into adulthood. Additionally, parents of these children often need to take their children to a greater frequency of doctor appointments and are at risk of missing work or passing on work opportunities. Luckily, there are regulations that are put in place that we will talk about that protect parents in these situations. In a study conducted by the European Child Adolescent Psychiatry Journal, there was also a very disturbingly high amount of abuse by children against parents who had ADHD. There's an interrelation between different forms of abuse. This study contributes to an increased awareness of the abuse of parents by their ADHD children. And this ties into that impulsive and possibly aggressive behavior, especially in boys who are just being diagnosed with ADHD between the age of 12 and 17. Additionally, similar to parents, healthcare workers must protect themselves from potential violent outbursts and aggressive behavior. It is worth noting that this does not apply to all types of ADHD, nor to a patient with well-controlled symptoms. The nurse may need to repeat instructions that require patient focus to protect the patient and faculty also. This can include instructions on safe patient transferring and other hospital procedures. Due to attention changes among ADHD patients, when ADHD is not cared for, health literacy should be assessed even further because health literacy can go down. That just goes with a lack of attentive awareness. Understanding that ADHD not only affects the stakeholders, It's also important to closely examine ADHD and its role in culture and health within the U.S., and it's important to look at regulations, development, and laws as it pertains to ADHD, because it also pertains to ADHD patient outcomes. The Rehabilitation Act, the American with Disabilities Act, the Family and Medical Leave Act, the Disabilities Education Act, and the amendment to the ADA Act all fit together generally prohibit discrimination against individuals with disabilities in higher education and the workplace. But more importantly, all these acts come together and affect ADHD in separate ways. It wasn't actually until the ADA Amendment Act of 2008 that qualified ADHD as a disability. So to go back to 1973, where Section 504 of the Vocational Rehabilitation Act, a civil rights law, prohibits programs that receive federal funding from discriminating against children with disability, and under any circumstances requires schools districts to make accommodations for ADHD students directly. Additionally, many people don't know that ADHD is covered under both the Rehabilitation Acts and American Disabilities Acts. But this means that an employer cannot discriminate against someone with ADHD and must provide reasonable accommodation in the workplace. The ADA includes ADHD and is recognized as a disability under the ADA. For an employee who has ADHD, the Act can require the employer to provide reasonable accommodations as long as it doesn't create an undue hardship for the business. For example, if the person diagnosed with ADHD has difficulty working because of noise, they can request a private office with a door. If that's not possible, placing your desk in a non-central location where fewer people will pass by is also a reasonable accommodation. That's to be seen that the workplace makes a strong effort. The Family and Medical Leave Act essentially allows families of children with ADHD to have possible leave. This leave is still unpaid, but it allows families to take a break from work if they need to care for their children. The Disabilities Education Act requires schools to make reasonable accommodations for ADHD patients, like a low distraction or private room during proctored exams. Under the ADA Amendment Act, a child with ADHD can be considered disabled. This is the biggest political win for those with ADHD and their families. This means people with ADHD qualify for all aforementioned programs, and families with children with a disability qualify for tax, financial, and workplace medical leave as it relates to having children with a disability. This can mean large financial qualifications for parents. Veterans with ADHD may qualify for disability, and those with ADHD qualify for disability and Social Security disability. Essentially, because of the 2008 Act, those with ADHD qualify for all current disability programs and future disability programs. While the Rehabilitation Act did allow ADHD to be recognized as a disability, it was not recognized as a disability for Social Security, which also expanded under the ADA Amendment Act. While all these laws, policies, and regulations have been a huge win for ADHD patients, there's been some issues with the Medicare and Medicaid and insurance follow-ups as it relates to ADHD care. The Children's Health Insurance Program Reauthorization Act of 2009 put in some placements that required 2 behavioral health care measures related to follow-up care for children with attention deficit hyperactivity disorder. These follow-up care measures required doctors to create a follow-up care plan and to implement behavioral therapy within a certain time frame. But unfortunately, the Office of Inspector General in 2019, 10 years later, found out that 500,000 Medicaid-enrolled children who had newly prescribed ADHD medication did not receive that follow-up care in the time frame that they should have, and 54,000 children were not even offered any kind of behavioral therapy based upon the professional guidelines. Since this recent exposure in 2019, policies were shown that they were guiding preferred practices for ADHD treatments, basically saying that because of the CHIP Act was being taken by physicians to say we prescribe and then we treat with behavioral therapy because that's what Medicaid is using as a guideline. But now states are going against that, and there are a few protections that have being put in by several states that are saying that alternative therapies have to be considered before putting forward a pharmacological intervention. One state, Florida, requires the prescriber to demonstrate not only that non-medication treatments are considered, but that adequate trial failure to improve the patient's symptoms without pharmacological intervention was attempted and completed. So there had to be some recognition of behavioral therapy over a longer period of time. Also, most insurance plans, including Medicaid and Medicare with prescription drug coverage, will cover a percentage of the cost of ADHD medication. This is actually a big win, but it doesn't necessarily mean that it will cover all of the medication, and often this refers to generic medications if it is an option for insurance to take. Additionally, adults with ADHD can qualify for disability benefits, but only in cases when they can prove that their ADHD prevents them from performing substantial gainful workful activity, which means there is no progressive qualification of disability, but simply that the patient is only able to work or they're not to qualify for disability in the Social Security Act. After discussing Medicare and Medicaid, it is also important to discuss the financial burden that can occur with ADHD. Not only do we see an overwhelming statistic behind ADHD, which suggests a large financial cost, but additionally the individual care cost of ADHD is greater than other common pediatric conditions. In a study done by Dr. Eugenia Chan and published in the Pediatric Medicine Journal, it was identified that there were 165 children with ADHD, 322 with asthma, and 4,952 with neither diagnosis. Among these populations, ADHD has significantly higher mean total healthcare costs compared with children with asthma and general populations. Additionally, according to an article in the Scientific Reports, attention deficit hyperactivity disorder has been associated with an increased risk for physical comorbidity. Neurological conditions were significantly associated with the diagnosis of ADHD in children. Underpinning of altered brain development might not only affect multiple domains of cognitive and other behavioral function, but also increase the susceptibility of neurological health issues. There's also been recent research tying in GI health issues with ADHD. But more importantly, according to a 2016 National Survey of Children's Health, 2 out of 3 children, which is 63.8% of patients with ADHD, had at least one co-occurring condition, which means comorbidities are in the vast majority of patients who have ADHD. ADHD also has long-term negative outcomes for many children, including decreased educational attainment, work performance, and occupational stability compared to individuals without ADHD. So all those factors affect the economic stability of the patient, they affect the patient's family, and the comorbidities also will affect the patient's need for further health care and the costs associated with health care. So now let's look at the families. Because of the broad impact of ADHD, the disorder is likely to have serious economic implications for children, family, and society. Research has only recently begun to examine these economic impacts, but the initial studies suggest that ADHD leads to increased costs in healthcare and other domains. A recent study conducted by Swenson and colleagues suggests that childhood ADHD also places an economic burden on the parents and other family members. This analysis was conducted using data from a national sample of 100,000 people who were beneficiaries of a large U.S. company that was not told in this study. Family members of individuals affected with ADHD had 1.6 times as many medical claims as match-controlled individuals without a family member diagnosed with ADHD. The greater healthcare utilization and increased costs led to about an annual direct per capita medical cost for families of about $2,740 at this time. Then for family members of control patients, it was about $1,365, which is under half. A nationally representative U.S. survey conducted suggests that mothers of children with ADHD perceive their financial impact of their children's disorder. Compared with mothers whose children do not have ADHD, mothers with children who do have ADHD were 3.3 times more likely to say that families could not afford prescription medications for the child, and 7.4 times as likely to say that family could not afford mental health care for the child. Another study of the perceptions clearly demonstrate that substantial economic burden of ADHD. Several longitudinal studies have shown that childhood ADHD is associated with criminality additionally. For example, a study conducted by the Los Angeles county government found that children diagnosed with ADHD between the ages of 6 and 12 old had significantly higher juvenile rates of juvenile incarceration. That was 46% juvenile incarceration versus 11% in that area. And the financial impact could be only assumed from this. Children with ADHD have been shown to be more accident prone than other children, including costs that could be associated with accidents. So these are not the only four areas where ADHD increases financial burden, but we really see it in the comorbidities, the medication, how this affects both these healthcare costs affect families, affect the patient, the long-term outcomes that relate to employment, education attainability, and how that affects the economics of the individual, and possible accidents or injury as it relates to attention deficit disorder. There's also a financial burden on healthcare, government, and society. In this study, which was conducted by the ADHD Institute, it was the healthcare system annual costs were around $320 million, pharmaceutical annual costs $63 million, reduction of taxation annually was almost $1 billion, and the estimated combined total disability costs as it relates to ADHD, which are representative of losses, whether it's healthcare, government, or any other party, was about $7.45 billion. The graph on the left represents the data that was mentioned in the last slide regarding ADHD versus asthma versus non-asthma and the potential cost of healthcare for those patients. Not only is the healthcare system, the government, and the society affected by ADHD, but the individual is affected by ADHD treatments. So overall, we're seeing a population where there is possibly poor quality of pediatric ADHD care, which can lead to increased healthcare costs as adults. Adult ADHD visits have increased in recent years and are associated with psychiatric comorbidity and reimbursement challenges, leading to limited treatment in ambulatory settings in the United States, as well as an increased financial burden on the individual and the healthcare system. As a soon-to-be nurse, I'm excited to talk about the nursing role in this care, because nurses really do make a difference in ADHD care. Nurses who provide care to children and their families in the hospital, school, juvenile justice, and community are important members of the teams that provide diagnostic treatment and supportive services for ADHD patients. Nurses provide care not only to children and youth with ADHD who are hospitalized for other diagnostic reasons such as having special health care needs or disability, but also to those in the community setting where children and youth with ADHD live, play, and work. Pediatric nurses, whether in the hospital or community setting, have numerous opportunities not only to provide direct services to children and youth with ADHD, but also to educate children and youth themselves, their parents, and the community-based colleagues about the continuum of care, monitoring the children's responses to the behavioral management program, and medication for comorbid symptoms and early signs of at-risk behaviors can all be detected by nurses. It is a concern that children and youth with ADHD demonstrate an increased need for services and treatment from medical, mental health, and educational providers, as we covered. It would appear that children and youth with ADHD would benefit from care coordination, as do other populations of children with special health care needs and disabilities, to improve the reported outcomes of care. Public health nurses must find creative approaches to screening and regarding ADHD in community. ADHD is a serious public health concern because of its high prevalence, chronic nature, significant impact on school performance, family life, and its impact on peer relationships, and estimated annual costs. School nurses are the main care providers in schools and provide primary prevention for students who show symptoms of ADHD. They also play an important role in raising awareness of ADHD by enhancing the health service delivery model for afflicted children and families. This is also where all those regulations, the ADA, the Family Leave, the Educational Act, for disabilities, all of these regulations come into play because school nurses perform as ADHD educators for families and their children and the school place who are affected by the condition. They encourage families to seek therapy for their children at healthcare institutions, since most parents are scared that their children will be labeled and stigmatized because of its ADHD is a mental health illness, and we're still dealing with a mental health illness stigmatization in this country. School nurses also create and implement programs and workshops to fight the stigma associated with ADHD and raise awareness about child behavioral programs. They also develop culturally relevant methods to care for the affected children and provide support, education, and information to families, children, and community. They also collaborate with other healthcare providers to initiate national screening programs for identifying behavioral health issues in children with ADHD and school-age and younger education children with ADHD. Children who show symptoms of ADHD, this may be caught by the nurse themselves, and who can refer to care through a provider. If a child is diagnosed with symptoms of ADHD, the school nurse can then assist them in implementing and following the framework the school and the nurse themselves get to set up for ADHD patients. In addition, nurses in the acute care setting, in the educational care setting, and in the clinical care setting and community health care setting all have a voice in ensuring that children, young adults, and adults diagnosed with ADHD are treated according to the evidence-based standards that we have, and not only just the Medicare guidelines that have been recently implemented into care. Best practice standards emphasize the importance of conducting a thorough assessment incorporating input from both home, school setting, and the child's behavior before any stimulant medication, and the follow-up care after a medication is received for the child. Advocating that approach to care in practice settings, if it's a physician's office, again, a community health or mental health nurse, in a school, or even a hospital, and making sure you're instructing parents, making sure that you're instructing other healthcare providers on these best practices, all can contribute to reducing the over-identification of stigmas, which include male children having ADHD over anybody else, hyperactivity being the only sign of ADHD, the need for prescription stimulants over behavioral cognitive therapy. All of these are stigmas that the nurse can help overcome. When nursing roles come together and approach ADHD, they do not just approach the social prevalence of ADHD, but they also approach the individual's needs. Nurses can provide social justice for populations with ADHD. The nurse for social justice is able to provide cognitive therapy, provide resources for continuity of care, reduce pharmacological interventions, and thus provide for justice where the patient with ADHD is not prescribed based upon regulated treatment guidelines, but based upon individual needs. There are multiple types of ADHD, thus multiple needs. The nurse can advocate research and help create an evidence-based practice that does not only consider patient goals and outcomes, but individualizes care and reduces that need for pharmacological interventions and potential side effects. Nurses can promote social justice through providing financial resources and educating families on the acts of the 2008 amendment discussed. Families struggling to pay for their children's needs and adults who are unable to maintain employment because of their disability all qualify for financial resources and disability subsidies. In many cases, it is up to the nurse to bridge the gap and provide their patients with these needs. To do this, the nurse can use their voice to educate and not only tell the patients on the laws and regulations, but also translate this to a workplace. Nurses are able to provide justice for their patients when they educate school systems and workplaces about patient needs, accommodation, and non-discriminatory regulations. In this role, the nurse does not only provide justice for their patient, but provides justice as it relates to the law and healthcare. Additionally, through the tracking and research methods, nurses can provide reform and evidence-based practice for research that provides resource allocation and changes the cultural view and healthcare mentality for ADHD, but by research provides justification and statistical evidence of population and patient needs. Additionally, nurses can campaign, represent, and volunteer on behalf of various organizations, including the following: children and adults with attention deficit hyperactivity disorder, Attention Deficit Disorder Association, and ADHD Aware. So just in conclusion, I feel like as a whole in this presentation, understanding, learning to care for, and reforming care are all subjects that can be approached in ADHD from the point of view of a nurse. If you are interested in my references, they are below. Thank you so much for watching this presentation.